There is an extremely high degree of information and knowledge asymmetry between the doctor and the patient and between the doctor and the insurer. We want to briefly examine the issue of doctors and their attitudes towards economics and how this affects my confidence and trust in doctors and in hospital systems. We will also briefly talk about the issue of medical malpractice and how doctors can dodge lawsuits. So, coming back to this knowledge asymmetry, because this is a complex subject and because the consequences are irreversible of a decision that we take, this knowledge asymmetry between that the doctor has an advantage over could be used or allows the doctor to manipulate the relationship, the medical relationship between either with the patient or the insurer. There is this idea in microeconomics or this concept called induced demand. So, what happens in a relationship between the doctor and the patient is that the doctor translates the patient's medical condition, demand, into a series of prescriptions, diagnostics, treatments, medical care plan, consumption, or supply, right? So the doctor, in a sense, is both the producer and the consumer. And this gives the doctor extraordinary power to manipulate a relationship. Despite all the advances in technology and the availability of online AI tools, patients and consumers like us will always remain uncertain and hope that the doctor does the right thing. And we cannot generally protect ourselves from a poor quality of diagnosis, poor diagnosis, and poor quality of care treatment and design plans. Healthcare is a social good, as Kenneth Arrow said, and the existence of social obligations prevents the doctor from behaving like an overeager car dealer salesman person, if you will. But can we continue to count on this innate goodness of doctors, where it is the patient's well-being that provides the doctor his or her ultimate satisfaction and happiness? We know that most of the doctors are part of a fee-for-service, a dominant fee-for-service healthcare system. In emerging markets, it is mostly private. And we know that in most of these private fee-for-service healthcare systems that are listed in public stock exchanges, all the rhetoric aside, shareholder was, and will probably always be the king. And their interests will always be dominant, and every other interest would eventually be subservient. So, what safety nets do patients like you and I have in a situation like this, that the doctor, because of this induced demand idea, where the doctor is the consumer and the provider, the person who creates the demand and also provides the supply, how can we protect ourselves against this asymmetry? And this is where I wanted to examine a few studies to give us a glimpse of what are the doctors' attitudes in general towards economics. And then we will look at the rise of medical malpractices and lawsuits against doctors, and what can doctors do to dodge such lawsuits. Let's look at this study up next. As I wanted to examine doctors' attitude towards economics and payment-related issues, other than subjective observations and individual interviews, I didn't have much to report. Luckily for me, I stumbled upon a study conducted by Johns Hopkins. It gives us a glimpse into doctors' attitudes towards economics in general. It's not a direct answer, but a proxy, especially in the absence of any other study that I could find that would help examine my assumption about doctors' attitudes towards pricing, economics of hospitals, and cost control. The survey that Johns Hopkins conducted invited about 3,318 physicians to participate with questions concerning their healthcare practices. This was published, and I summarize some of the key results below. Most surveyed physicians believed that it was the lawyers, 60% of them, or the health insurance companies, 59% of them, or the hospitals themselves, 56%, or pharmaceutical and device manufacturers, another 56%, and even patients, 52%, as having, quote unquote, major responsibility for reducing healthcare costs. It was stunning for me to recognize that only 36% of the surveyed physicians reported that they themselves, as physicians, have major responsibility for cost reduction and cost management. Most were, quote unquote, very enthusiastic for promoting continuity of care, 75% of them, and expanding access to quality and safety data. They were also, 51% of them, in favor of limiting access to expensive treatments with little net benefit as a means of reducing healthcare costs. A disappointing result for me was that only 7%, barely 7% of the doctors expressed enthusiasm for eliminating fee-for-service payment model. They seem to be happy with a model that keeps paying them and the hospital for doing more stuff without much accountability for outcomes. Physicians reported that they were aware of the costs and tests of the treatment they recommended. They agreed that they should adhere to clinical guidelines that discourage the use of practices, clinical practices, whether diagnostics or treatment, that are marginally beneficial, and agreed that they should be solely devoted to individual patients' best interest, even if that is expensive. 89% of them agreed that doctors need to take a more prominent role in limiting the use of unnecessary tests. Some of the other key findings from this study was that unnecessary medical services in the United States represent majority of wasted healthcare resources, accounting for an estimated $210 billion in excess spending. Respondents reported that 22% of prescription medication, 25% almost of tests, medical tests, about 11% of the procedures, and 21 almost percent of overall medical care is unnecessary. Think about that and let that sink in. The median response of physicians who perform unnecessary procedures for profit motive was around 17%. And it was interesting that physicians, slightly senior physicians with at least 10 years of experience after residency, and consultants, specialists, were more likely to believe that physicians perform unnecessary procedures when they profit from them. And the top 3 reasons cited for overuse of resources, which is unnecessary treatment, unnecessary diagnosis, and procedures, were fear of malpractice, patient pressure, and difficulty in accessing prior medical records. These survey results momentarily dented my assumptions and confidence about my doctors. You can't help but notice the dichotomy and hypocrisy in the doctors' responses when it comes to reducing costs and their own roles in it. Traditionally, the doctor has been paternalistic, under whose care the patients, quote unquote, submit and cooperate willingly like obedient children. The doctor was seen as a benevolent dictator who knows what is good for the patient. And the doctor's quote unquote happiness is a derivative of a cured and quote unquote happy patient. The paternalistic power is regulated by the sense of responsibility in doctors. This is okay by me when it is just me and my doctor. But now we are both, the doctor and I, immersed in a complex and turbulently violent ecosystem. In such a situation, I just hope that my doctor will do the right thing. And I also know that he or she will always try to do so. Doctors and lawsuits. In conclusion, on this section on doctors' attitudes towards economics and malpractice lawsuits, etc., there is a spurt in medical legal cases worldwide, and this is a matter of some concern for a lot of doctors. Concern because much of it doesn't quite accurately reflect the doctor's situation and context, but also because it encourages doctors to practice what I think is more defensive medicine, to be safe, which drives up costs for everybody. It is also unfair for a sincere, hardworking, conscientious doctor to feel vulnerable to litigation and that somehow affecting his or her performance. I'm not sure if you've noticed, but our general physicians, our family doctors, our primary care doctors are usually more accessible, friendlier than the tertiary care super specialist counterparts. I found that my primary care doctor does a lot of small talk, a lot of PR, engages me in conversation, talks to my wife, talks to my family. They spend time educating patients. They're more likely to laugh with patients and relatives. And they also tend to encourage patients and their bystanders and relatives to express their opinions. They're probably more likable, more cordial than the super specialists, consultants in these large, complex tertiary quaternary care hospitals. And you know what? They're not sued as much. Could it be that their friendly, likable, cordial nature is the reason that primary care doctors get sued a lot less than their tertiary care super specialist counterparts? Seems like it might be. A study published many decades ago, probably 3 decades ago, surveyed patients who sued physicians and also physicians who were sued and physicians who were not sued. The patients who sued and the doctors who were sued disagreed on almost everything except one. A vast majority of the surveyed patients who sued and the doctors who were sued both agreed that improved communication could reduce malpractice litigation and doctors and the lawsuits that doctors have to face. So this study was published in 1989, clearly showed that 97% of the patients who sued reported negligence as the reason for their malpractice action. But only 10% of those physicians who were sued thought that negligence was the reason for the claim against them. Only a fifth, less than 20%, of the patients who sued reported financial compensation as their motive for suing. But 80% of the physicians who were sued thought that that was the main reason that the patient had filed those lawsuits. But almost 70% of both groups, doctors and patients, thought that improved communication could reduce future malpractice litigation. The message for doctors is loud and clear. If you don't want to be sued, listen more and laugh often.